Hi all, welcome to Raaonline. Why you have to take this critical care medicine module? It has about 9 specialties, 180 video lectures, 16 tests, 214 reading materials, and what is more important is you have experiences from 150 leading intensivists throughout the globe. What is so special about this critical care module? It provides a virtual practical experience in support of classroom theoretical knowledge through animation and simulation, and it provides an integrated wealth of book knowledge, online videos, live ICU experience, and a single efficient and easy smart platform. Not only that, it provides several drone-like videos which provide a first-hand view of complex procedure that could otherwise not be available for viewing in any form, explaining the unseen areas in critical care where there literally have been few or no guidelines exist to keep pace with innovation and discoveries in the field and be able to cherry pick useful information from the enormous data available. Finally, a good practical demonstrations of various equipment used in the intensive care like ventilator, ABG machine, practical and critical reinforcement by the best of experts in the respective field. Now let us look at the various module which is available in this comprehensive critical care medicine. First comes the critical care pearls. Critical care became an integral part of management of many medical and surgical specialty. All the patients in this unit were managed by admitting physicians, which was called as open ICU previously. Of late, the concept of closed intensive care unit, which are headed by critical care specialists, are now fast becoming the standard of care. This module tries to fill the knowledge gap for those routinely encounter critical care patient in the professional practice and needs sharpening the knowledge with a solid theoretical foundation, also practical critical pearls. This module has about 27 video lectures and you have top experts talking on this. It is comprehensive, covering all aspects of critical care pearls. Coming to the next module, arterial blood gas. ABG is an inevitable boon in managing critical ill patient, not only being a diagnostic tool, but also to monitor and prognosticate the critical illness. Its versatility dictates valuable information like oxygenation, ventilation, nutrition, hemostasis, hemodynamics, hydration, so on and so forth. So whatever a critical care specialist requires is there. Like a magician with magical wand, is so the intensivist with an ABG can do wonders if mastered perfectly. This arterial blood gas module has about 13 video lectures, 19 reading materials, and 1 pre-test and 1 post-test. What is so significant in this is it is contributed by expert faculties like Professor Jiggy Devaidya, Arun Kumar, Dr. P.C. Vijay Kumar, Dr. Ramesh Venkatraman, so forth. Coming to clinical nutrition, intensive care unit are basically organ support unit. They support respiratory failure with artificial ventilation, cardiac failure with inotropes, vasodilator, vasoconstrictor and intra-arterial balloon pump, renal failure with dialysis or renal replacement therapy, and other organ-related alignment with similar organ support. When all this happens, it cannot be denied that many a time we tend to forget gastrointestinal failure with nutritional support. Clinical nutrition, which can be a game changer in critically ill patient, is still a developmental science. However, it cannot be denied that it is most often neglected by the physician. This critical nutrition module has about 18 video lectures with leading faculties all over the country, and it has pre-test and post-test. Coming to ECMO, the use of extracorporeal membrane oxygenator has been exponentially increasing over the last decade and now considered a mainstream life-saving treatment modality in critical care medicine. However, the need for physician education, training and experience remains imperative. Although ECMO has traditionally been used in end-stage lung disease and circulatory collapse, it is being adopted for use in right heart failure as a bridge to heart and lung transplant and as rescue therapy for both sepsis and post-organ transplantation. This ECMO module has about 15 video lectures, 2 tests, that is pre and post test, and 25 reading materials. And you can see the practical demonstration of ECMO being inserted and a clinical discussion with various specialists involved in ECMO. It has contribution by all leading faculties over the country. Coming to theoretical aspect of managing the electrolyte and fluid. Electrolytes are important because they balance the amount of water in your body, balance your acid-base status, move nutrients into your cells, moves waste out of your cells, make sure that nervous system, muscular system, your heart and the brain work. So it is imperative for the critical care physician have a thorough understanding of fluid and electrolyte balances as well as imbalances, and the most important thing is also the proper way of managing the electrolyte disturbances. Now coming to imaging modality, which has undergone a sea of change in the last decade. Point of care ultrasound is increasingly acknowledged as a valuable tool for rapid and effective decision making, enhancing triage, diagnosis, therapy, monitoring and follow-up of the critical ill or injured patient. In near future, we can't imagine ICU management without the help of ultrasound. Basic and advanced competency in echocardiogram, airway and lung, abdominal, vascular and gastric ultrasound is required for all intensivists. This online course of imaging covers ultrasound as well as basic and advanced echocardiogram. This basic and advanced echocardiogram has 31 video lecture covering from physics of echocardiogram to a treatment of heart failure, has about 33 reading materials covering entire theoretical aspect of echocardiogram, one pre-test to assess your basic knowledge and post-test to assess your knowledge after you finish your module, and you have about 12 leading experts who are certified in echocardiogram doing it. And the most important thing is the wet lab, which shows the heart anatomy. In addition to echocardiogram, we have the ultrasound module. We have about 21 video lectures, 2 tests, one pre-test and one post-test, and 42 reading materials. It covers the ultrasound from head to toe. Now coming to the most important part of critical care module, that is mechanical ventilation. Mechanical ventilation from time immemorial has been the mainstay of critical care. Despite so many modes and plethora of advancement, clinicians still continue to face problems regarding the appropriate ventilatory setting. Proper knowledge of the weaning modality and advanced mode can easily change the outcome of critically ill patients. It's perhaps the first area of technology where artificial intelligence was incorporated before this terminology became popular in other health spheres. This mechanical ventilation module, it has about 20 video lectures, 2 tests, one pre-test and one post-test, 52 reading materials covering the entire gamut of mechanical ventilation, and it has experts spread all over the country who are an authority on mechanical ventilation. You can see the majority of the video lectures being displayed here, covering the entire aspects of mechanical ventilation. Now coming to the last module of comprehensive critical care medicine, that is basic and advanced hemodynamic. The purpose of hemodynamic monitoring is to identify abnormal physiology and intervene before complications occur. The most common type of invasive monitoring are central venous pressure, pulmonary artery pressure, and arterial pulse wave analysis. Hemodynamic monitoring is essential to the care of critically ill patient. In the hemodynamically unstable patient, where volume status is not only difficult to determine, but excess fluid and drug administration can lead to adverse consequences. In this scenario, utilizing advanced hemodynamic monitoring can guide resuscitation and greatly alter the outcome in a positive way. This basic and advanced hemodynamic monitoring module has about 16 video lectures covering from a simple NIPP to a advanced cardiac output monitoring, true test, and 34 reading materials covering even technical aspect of hemodynamic monitoring. All the above contents are accredited by Tamil Nadu Medical Council. The most important thing is you will get a completion certificate with CME credit hours, which is applicable for all doctors throughout India. In addition, you get a course certificate from Raaonline, which will be generated immediately after passing the posters with more than 50%. In the previous video, I already explained about Anesthesia MD DNB package. Those who have not watched this video, please see the video link in the description page. The most important point here is comprehensive critical care package is useful for any general medicine practitioner, anesthesiologist, pulmonologist, or any physician who have a liking for critical care. Postgraduates must make use of all this content. We have MD DNB General Medicine as well as MD DNB Obstetrics and Gynecology package too. Please download RAAONLINE app and get your access soon. Thank you.